Hello, my name is Dr. Rizwan Riaz. I am an emergency medicine registrar. I am part of the team looking after Mr. Johnson. Can you please sit down? This is my nurse. She'll be here during the interview. And examiner, I would like this session to be private, so nobody disturb me because I need to break some important information. What is your name? What's your name?
Julie.
Julie. And can I confirm you are Julie's, Mr. Johnson's daughter?
Mm-hmm.
Okay. So what do you know so far about him?
I just received a phone call.
Mm-hmm.
And they told me that they had a very bad accident.
Okay. And have you recently seen him? When was the last time you speak to him or see him?
I talked to him last night.
Okay. And was he doing okay? And
Yeah, he was fine.
no illness, no sickness? Did he complain anything?
No, he didn't.
Okay.
What happened to him?
Yeah. I'm sorry I need to tell you this. I don't have a good news for you. He had a bad accident at his house and hit his head.
How is he now?
I'm sorry, he's not good. When he arrived here, actually what happened, he fell down at his house and hit his head. So when he arrived here, he was completely unconscious, completely unaware of surrounding, not responding to anything, and his breathing was not appropriate. So
So what does it mean?
so after that, we put a tube inside his chest so he can breathe properly. So a machine is breathing for him.
Okay.
And then we did some investigation to find out what kind of injury he had.
He will. So what is the next step?
I mean, we already did the next step. We investigate. We did a detailed X-ray of the brain, which is a CT scan, and unfortunately, we find a significant amount of blood in his brain. And the amount of blood is too much, and so after that we called our brain surgeon to look into it. So they have examined him and they have seen the CT scan, and I can show you the scan here. This is the scan, and there is a large amount of blood compressing his brain. So
Will he be all right?
I'm afraid to tell you no, because brain surgeon has seen him and examined him, and there is nothing they can do to treat him. That means the bleed is inoperable and he's not gonna survive.
This procedure is just because of his age, or?
No, I just want to reassure you that this is not because of age. This is because by the time he arrived here in the hospital, so much damage has already been done. I mean, there is nothing we can do to treat him. The brain was already damaged, brain dead. So the operation cannot be done, and there is no point doing an operation on a dead brain.
Okay. Can I see him?
Yes, you can see him, but I just want to tell you that we would like to remove the tube, and as soon as we remove the tube, he is going to die.
Okay.
Would you like somebody to call before you see him, or you want to see him by yourself?
Yes, I want to call my sister.
Okay, we can arrange that for you. I just want to reassure you that me and my whole team is here to support you, and we have lots of support available. We have phone numbers and all the information. I would like to give you some leaflets as well for the bereavement offices, so you can call them for the funeral processing, and we can arrange a telephone call for your friends and sister, whatever whom you want to do. Do you want to call any religious priest?
Yes, I want.
Okay, we can do that. We have a religious priest office in our hospital. They can come and comfort you.
Okay.
Anything else you would like to do?
I just want to see him.
Okay, yeah, of course, I can take you over there. I just want to tell you that my nurse will be here with you to comfort you. If you have come up any questions, concerns, you are feel free to ask, and my team will be here. And I just want to reiterate one more time. I know it's very difficult for you. It's very hard to understand. Just want to give you one more time the brief summary what happened. Mr. Johnson came here, and he was significantly had a bad injury in his brain, and after that he was completely unconscious. So we put a tube inside his chest to breathe for him, and we did a CT scan. Unfortunately, it didn't show at a good window. I mean, there was a lot of blood, a lot of compression, and our brain surgeon has decided that there is nothing they can do to treat him. This is a non-operable bleed. So next step would be we will remove the tube, and then he's going to die. Okay?
Okay.
All right. I'm sorry I have to tell you this. My nurse will be here. Okay, we'll